Hello, everybody. This is Dr. Kevin Connors with another episode of Connors Clinic Live. Today, we have a very special guest, Nathan Crane. We're going to introduce you to him, introduce you to his full-length documentary that he created, some books that he's written, his online community that he's just launched, which sounds exciting. We just got done discussing it briefly, and I want to ask him more questions about that, because I think, as we were discussing, that in today's age with the whole COVID thing going on, everybody is very isolated, and there's a huge danger in that. We're no longer a community of people that are connecting with one another. We need to reintroduce that somehow, where we do have that connection. Unfortunately, not the physical connection, but some way electronically where we don't feel so isolated and alone. Let's dive right into that. Nathan, thank you for being on today. What is your new online community, and explain that a little bit to us?
Yeah, well, thanks, Dr. Connors, for having me on. Thanks for the great work you do. As we were talking just briefly offline, both the positive and the negative of our current time, right? The positive, we can reach millions of people around the world through this great technology and share this information in ways that have never been shared before, life-changing, life-saving information that can reach somebody, at the click of a button. They can go online and access your podcast, join my membership, watch a documentary, attend an event, and learn more in a few hours than human beings we ever could before, ever in human history, right? Because we used to have to find a master and apprentice with that master and spend years and years with that master, learning from them until we ourselves became the master. And now, with a few typings on the keyboard, we can find the answer to just about everything we want. That's a positive of our time. The negative of our time, right, is that not all information is created equal. And it's one of the reasons that I actually opened up what I call the Health and Healing Club. And the Health and Healing Club is, I've been in natural health for about 15 years after going through, my own health challenges and addiction and homelessness and things like that. I dove into natural health and started learning and experimenting everything I could about living a healthy, natural, vital, vibrant, happy life, and learning and sharing as I went along. And along that journey, you find a lot of conflicting information, right? The more you research, the more conflicting information you'll find that will support anybody's theory or thought. The more that you interview experts, you learn from other speakers, from other doctors, from other, what we would consider experts in health, the more you find out that the information is conflicting in a lot of cases. And what I found out along the way is that there are three main reasons why we fear something like cancer, right? And the three main reasons is, one, we either don't have enough information, right? We just don't know enough about it. You don't understand cancer, what causes it, what its solutions are, what gets rid of it. You're going to be afraid, right? Because we just don't understand it. So not enough information. And that was my point. You can also search online and not find enough of the right information, right? The first 20 pages of Google are all going to be, listings from pharmaceutical companies and from Mayo Clinic and from, conventional therapeutic approaches, right? You've got to go deep to find anything beyond our, conventional approach to cancer or any disease if you're searching online now. So you have to dig a lot deeper than that. The second reason we fear something like cancer is because of too much information. I've been producing summits and conferences and documentaries and writing books and masterclass I'm teaching, 9-module masterclass coming up for years now. And, 15 years in the natural health field, 8 years dedicated specifically to cancer. And someone may attend an event I do that has 60 world leading experts. And if you tried listening to all 60 at once, you would have information overload. That's the truth, right? But we don't put 60 there so that somebody listens to all 60 at once. We put 60 there so that you can find the information you need in that moment to help you further along your path a little bit further. And so too much information can be a challenge, and people, we get overloaded and then we do nothing, right? So it's finding the right balance in information. And then the third reason we really fear is because of misinformation. We've been told one thing when maybe that thing's not the complete truth. And not necessarily that person was trying to mislead us, right? I think most doctors, most experts, most health teachers are trying to do the right thing. They're trying to help people. I really believe that in my heart, that most people helping people with cancer or any chronic disease really care about them and really want to help them. But they themselves may not have all of the information, right? And so they may be spreading misinformation unintentionally. And that itself leads us to fear something like cancer, right? Because we may hear something, ketogenic is the cure for cancer, and then over here, no, ketogenic is the worst thing for you. It's going to cause diabetes, and it's not going to help your cancer. And cancer can switch to ketones from glucose as a fuel source. And so then someone goes, oh my God, what do I do? I don't do anything because I don't know who to trust, right? And so that's actually the reason I started the Health and Healing Club, was because through thousands of hours of personal research, hundreds and hundreds of interviews, looking at hundreds and hundreds of scientific studies, interviewing the people who've overcome cancer and diving in deep and saying, what exactly did you do? Starting to look at the commonalities, the patterns, the foundations, the principles. Eventually, over 15 years now, I came to a point of like, okay, it's a lot easier for me now to decipher between what really seems effective and what doesn't, what really seems true and what seems, maybe like a half truth, what is really working for people and what's not. And so I took the best of all that content and interviews and research, and we've put it into this membership site that anyone can access anywhere in the world. And then we're bringing in new faculty members and people I've worked with for years, world leading experts, of the top experts in the world that work hands-on with cancer patients day in and day out for years, for decades, thousands and thousands of cancer patients actually seeing what works and what doesn't work. And then we bring them on and we interview them, and our members get to ask them questions and get their most pressing health questions answered. Every 2 weeks we have our faculty team coming in and answering these questions. So it's really a membership that was designed to help people decipher through all the misinformation, the lack of information, the information overload, and give people more of not only a sense of a community but belonging, but a sense of, okay, I can actually be more empowered now. I can feel more confident. I can actually have some real solutions I can trust in that can help me on my journey forward in not only preventing cancer, but hopefully reversing cancer.
Well, that's fantastic. I see that third point so evident with our patients. And we talk to patients, we feel like the misinformation that they get or the disinformation that they get from standards of care, where they're not given any other options. Okay, right. This is what we have to do. We have to surgery or chemotherapy or radiation or immunotherapy, and that's their only tools in the tool bag. And then if the patients even remotely suggest using another approach, even adjunctively, they are just shot down completely. And that's kind of the cancel culture that we live in. But the cancel culture within standards of care has been going on a lot longer than the last year, where everything else is canceled out because their way is the only way. And it's people get frustrated with that. But they also, when you talk about those first two fears, you tie those all together, people are scared to death. They kind of are in shock when they hear the C word with their diagnosis. And it's easy for them to, out of those levels of fear that you just described, to follow down a path that maybe if they would have stopped and thought about it a little bit longer, scripture says there's wisdom in a multitude of counselors, where you just take a step back and you start looking at what other people are saying, that maybe you can make a more rational decision. And some people regret the decision that they made when they're ushered down a pathway that they didn't really have a chance to think about.
Absolutely. I'm sure you work with a lot of people who have experienced that exact same experience every single day. I've certainly met many of them and talked to many of them and interviewed them as well. I actually had a pre-interview with Steve Wallace yesterday, and he is going. I'm going to do a full-length interview with him for my upcoming masterclass called "Becoming Cancer Free." And his exact story is exactly what you just said. He had stage 4 carcinoma. He had a tumor right here on his neck. It had spread to lymph nodes, and he went to conventional oncologists, and they said, we need to cut this out of you right away. So he thought, okay, yeah, let's get rid of it. Let's do the surgery, right? So they did the surgery. They removed the tumor. They removed maybe 8 or 9 lymph nodes. And then, the follow-up, they had seen some hot spots. They had assumed it was spreading. By that point, stage 4, it does spread by that point, right? And so they said, okay, now we need to do the follow-up chemotherapy and radiation. And so something had just told him intuitively, internally, no, I don't think I want to do that, and they were really pushing for it, as they do. And he decided against it and started seeking an integrative approach, a more natural, holistic approach, started educating himself, going to different clinics. He ended up finding the Center for New Medicine, which is a colleague of mine, Dr. Leanne Keneally. They work, they've had over 75,000 patients that they've treated in her career. And they do an integrative approach. They do some low dose IPT and some, they will recommend surgery when it's needed, but they do a lot of natural and holistic therapies as well. And so he just kind of resonated with that a lot more, even though he didn't fully understand it, right? But he was listening, like you said, he was listening to that voice within, whether being guided, divinely guided by spirit, or what have you. But it was his own voice he was listening to, which is so important when making decisions, life changing decisions for our health, that we sit back, like you said, and we take some time, get other guidance, listen to other experts, get additional opinions, and sit inside ourselves and ask ourselves those questions, and sit and take some time to really reflect and to find out what path is best for us. And he's so lucky that he did that, because now, this is 7 years later, I'm talking to him. Not only has his circulating tumor cell count continuously gone down, but his other cancer markers have continuously gone down. You wouldn't say that he's totally cancer-free today, but all of his count, all of his markers, his biomarkers have continued to go down, The most important thing is he has not lost any quality of life whatsoever. And that's the key, right? The problem is if we just immediately jump into chemotherapy and radiation, immediately quality of life is going to be drastically impacted. We know that, your immune system gets destroyed, your body starts, falling apart from the inside out. You are killing your body. You're not only killing the cancer, but you're killing everything good about your body as well. And it's not I'm not saying you have to avoid chemotherapy and radiation. I'm just saying, it's important to understand all of your options, right? It's important to understand what options you really have. And so since he went down a more holistic, integrative approach, he has kept a very good, high quality of life. He says he has energy, he's healthy, he feels great, he gets to live his life the way he wants to. He's obviously changed his diet and his lifestyle and exercises and eats better, does a lot of things that we know you need to do to take back control of your health. But he didn't have that quality of life loss. Like, the thing that really sent me down the path of wanting to help people with cancer is when I saw my own grandpa go through cancer, and not really cancer, but the chemotherapy and radiation. I saw it completely destroy him, just put him in tremendous pain. He couldn't even get up to go to the bathroom without saying it was just, so much pain, the vomiting, the nausea, the sickness. And then it was shortly after that he passed away. And it really, was the treatment that took his life. And, I had wished and hoped at the time that I knew more about cancer and that I could help him. But, but I couldn't, and I didn't, and I was afraid, just like, most people are today. And that set me down this path, this mission, this just, desire to learn everything I possibly can so that I can not only protect myself and my family, but help everybody else out there who wants to, do whatever they can to not only extend their life, but add more quality of life to that extension, add more quality of life to their years. And in the process, maybe you end up like a lot of the people that I've had the chance of getting to interview who did reverse stage 4 cancer following, a holistic or an integrative approach.
Yeah, you made mention of the biggest reason why people look at an integrative approach is that, or at least that person, is because they've had family members that have had bad experiences doing standards of care.
Yeah.
Um, and many times that's the thing that shakes a person up a little bit because I don't know, I think, we have come off of this Marcus Welby mentality that we trust everything that our doctor says. But when we hear a serious diagnosis, we can tend to fall back into that really quickly. And I describe it as there's a part of us as humans that don't want to take responsibility for grave things. It's like,
Mm.
you have cancer. Oh my gosh. Well, I don't want to take responsibility for that because I might screw it up. So I'm going to just leave it in my oncologist's hands and trust them fully. And then many people, not everybody, but many people that do that regret it terribly afterwards.
Right.
Um, the ones that tend not to do that, at least the ones that we hear about, the people that call us often are ones that, well, I'm not going to do that approach because I saw my mom go through it, or I saw my sister go through it, and it didn't end well. Or they might still be alive, but they suffered horribly. They still suffer horribly from it. I just talked to somebody yesterday that was like, um, she was in our case review. That's our first conversation that I have with them. Sometimes they don't, explore a website, in depth, and they might feel like I might push them towards the standards of care too, because of course I'm a doctor, so that's what I'm going to do. And she was immediately defensive that I am not going to do standards of care. I would rather die earlier and live a healthier life up to that point than suffer through chemo and live longer.
Mm.
Um, and and I understand that's not always true. And of course, I'm an integrative practitioner, meaning that I'm not against chemotherapy. I'm just against unwise use of it,
Sure.
and or using it because you think that's the only option that you have. So it's it's great that more people are opening their eyes to integrative care. But in the same sense, it's sad that you see that split almost,
Yeah.
that um, that that doesn't need to be. I've often said our clinic and clinics like ours really should be attached to Mayo Clinic. We should be working together. If we really care about patient care, don't we want to do what's ever best for the patient, whether it be surgery and alternative care, or chemo and alternative care? Should we do whatever is the best thing for the patient and that be our concern, versus this dogmatic approach that we're stuck on because of our training or our financial ties? That's it saddens me.
It's true. I mean, it's the exact same thing we see going on right now with this pandemic, this virus, this COVID around the world, right? I mean, it's turned into so much more about a political affiliation and a political approach than it is about the actual health and well-being of the population. And wherever somebody stands on this side of COVID, it is clearly a strong delineation, separation between people who say, give me the vaccine, give me 5 shots of the vaccine. I'm going to wear 2 masks every day. I'm going to lock myself in my house because I know I'm saving lives, right? And they absolutely believe it, and they are 100% in alignment with that. And there's the other side. It is so the opposite, the extreme, that says, Absolutely not. I will not wear a mask because they've been proven not to work. I will not take vaccines because they can cause all kinds of health problems, including death. And I will not lock myself inside because actually outside I need to breathe fresh air and get vitamin D and all these other things. And you don't find a lot of people in the middle there. Certainly I haven't yet. I'm sure there are some, but it seems that people have really picked a side on this, and it's quite extreme. And it's been that way for cancer for way too long. People have picked a side. It's either conventional, allopathic, medical approach is the only approach, or naturopathic, no conventional medicine, all diet and lifestyle is the only approach.
Yeah.
And I am in 100% agreement with you. I think the only way forward as a society is that we have to come together and work together to say what are the most effective solutions for dealing with whatever the health challenge is, and implement those no matter what your bias may be, or what your political influence may be, or what your financial ties may be. We have to come together for the betterment of the individual, for the cancer patient, for the person dealing with the chronic health challenge, or who has been impacted by the viral infection. One of the challenges you see in this, and that's become very clear to me, of where our government stands, is in over a year now of this, viral pandemic, not once have you ever seen our government or our mainstream media or our leaders of this nation, or any nation that I've seen so far, come out publicly and say, look, you need to take care of your immune system. You need to eat healthier. You need to do whether you get the vaccine or not, whether you wear masks or not, whether you need to focus on your health as an individual, as a family. We're going to put together programs for you to take care of your immune system, because we know viruses, just like cancer, will only give you symptoms or problems if you have a weak immune system. We know the cure to cancer is a strong immune system, right? Dr. Thomas Lodi says it so clearly in my documentary, and it's been validated again and again. If you have a fully functioning, very strong immune system, you will not have a cancer diagnosis, because your body's doing what's designed to do and getting rid of those cancer cells every single day through the lymphatic system, through the T cells and B cells and all the beautiful functions of our immune system that removes cancer cells from our body every single day. The same is true for any viral infection. Why is somebody, the difference is cancer you make from internally, viruses you catch from externally, right? So that's a big difference we need to understand. You don't catch cancer, even though we kind of look at it that way subconsciously as a society, is like, oh, it's something I got cancer. No, you made cancer. Your body's been making it for many years. You just now discovered it, right? Versus, yeah, we can breathe in a virus, but it affects the body in very similar ways. If your immune system is strong and it's fully functioning, you may have a few symptoms or no symptoms at all, but your adaptive immune system and your innate immune system are going to kick in, and they're going to knock that thing, they're going to kick into overdrive and knock that virus out of your body, and you're going to be fine, right? But that's why we know the latest statistics for COVID, for example, which was, I can't remember the exact percentage now. I saw it a while back. It was like 96%, something like that, very high percent, maybe 99% of people who've died from COVID had 3 or more comorbidities, meaning their immune system was already totally weakened. They already had, cancer or autoimmune disease or diabetes, or a combination of all 3. They had other, health challenges going on. And then the virus was just the straw that broke the camel's back, right? So no matter what we're dealing with, we've got to go back to the immune system. And that's what an integrative approach should look like. Mayo Clinic, these other clinics out there that have been primarily conventional medicine for so long, they are now opening integrative divisions. The problem with that so far, in my opinion, is that those are marketing ploys to reach a larger demographic of people.
How could you? You mean they're just trying to piggyback on everything that we're doing?
Because you go and look at those integrative centers, and it's like, what do they really offer? They're not really offering much. They have a little room that you can go over and they call it a meditation room, and go do your meditation over there. It's this
Right.
little tucked away room in the corner, or they have, maybe, they don't even have PEMF devices in most of these places, but say they do. Maybe they have a PEMF device and you can use that for like an hour. And that's about it. They might have a couple, 2 or 3 things in most of them. Now, there are some that are, really advancing and moving forward, but most of them are not doing much in terms of actual integrative care. So that's what I love about what you're doing, is you're really focused on truly integrative care. It's looking at the best of what actually works from all worlds: ancient medicine, indigenous medicine, Western medicine, Eastern medicine, diet, nutrition, lifestyle. Let's do all of it, because that's what it takes, right? It takes treating the whole human being, as I say, the mind, body, emotions, spirit, relationships, environment, all of it. We have to treat all of it. If you would just take one herb or one capsule or one drug thinking it's going to cure you, I'm sorry, but it's not going to happen. We have to do it from a fully integrative approach. And the reason I say that is because all the evidence suggests that. And all the people I've interviewed who have reversed stage 4 cancers and are living many years past their expiration date, their prognosis, every single one of them has all of these commonalities amongst them.
Yeah, I would totally agree. Yep. And speaking again on you're saying that why hasn't the government shared information on building your immune system and improving your health as the number one responsibility of each individual to be able to overcome disease, whether it be a viral pandemic or whether it be cancer or heart disease, the number 1 and 2 killers in the United States. You have to wonder, and it makes people distrust the government, especially when they've gone even 4 steps further, and that so many medical doctors who have come out to speak that way and to say those very things that are in standards of care. Their videos have been taken off of YouTube, and you can't even find them. And goodness sakes, now that we mentioned the big C word, COVID, in this video, this video might not stay on YouTube very long. It's unfortunate. It makes people distrust the government even more. And then the people that aren't the seekers of information and the diggers to find videos like this and other information that gives them the hands-on ability to help heal themselves. Those people are just even empowered more to the other side. Well, see, there's no information on that. I Googled it and I searched through the first 20 pages, as you mentioned, and it was all data on a drug or data on something else. It's unfortunate that big tech is censoring all this stuff and making our problem even more difficult to get information to people. And that's what I love about you and so many people like you and I that are trying to get information out so that people can be helped. And I've said it for decades. We can't help everybody in our clinic. That's why we give away our books for free. That's why we give away our stuff for free. It's like, I just want to help people that could never come to us. And that's what I love about your website. You can get on, you can download your books and download your stuff and watch your videos, and you're just trying to help people. And I guess that's what it's all about. That's
Absolutely.
what people need to see the difference and
Yep.
sides that way.
Absolutely. And that's, I think we're coming to a precipice very soon of what is truly important for the human being, for the individual. What is really important for us as a human being? Is it my health? Is it my longevity? Is it my well-being? Is it my sense of joy and happiness in my life? Is it my sense of fulfillment and meaning? Right? You and I, we feel so much great meaning from service to others, from sharing and giving and helping and seeing people change their life. I think all human beings get a sense of joy and meaning and purpose when you help others in any way that you possibly can, right? Or is it convenience? I want more convenience. I want more comfort. I want more technology. I want more control over me, less me having to do less decision making, right? There's this, if you watch the information about the Great Reset and the information about from the World Economic Forum and what they're projecting for the future of humanity, that's everybody here tuning in. This is what they want for you. And this is why we have to question, is this what we want for us? Is they want for us to sit at home, and this is public, it's not some conspiracy thing. You can find them publicly speaking about it online. Those videos aren't censored, by the way.
Huh,
Even though our videos are getting censored, those
right.
aren't. So you can find them easily. And what they want for you, what they want for us is to sit at home, be surrounded by all kinds of smart technology, and have that technology make our decisions for us. They want that technology to make your decisions for you. What they say is it will make your life so much easier, where you can just wake up and ask your smart device, what should I do today? And your smart device will tell you what you should do today. And it might tell you, go get a vaccine. It might tell you, go get a fast food hamburger at Joe's restaurant. It might tell you, stay home because it's dangerous outside. It might tell you, the medical treatment for the day, and that's the only one, and natural health doesn't count. Don't listen to it, right? It might, whatever it's going to tell you. What they want for us is for us to do less thinking so they can do our thinking for us. Again, this is not conspiracy. This is public information of these leaders from the World Economic Forum publicly saying, and these are the tech giants of the world that are really controlling the world at this point, is they want a technocratic society, not only in the United States, but globally, where government is ran by technocrats. It's ran for the greater betterment of the technology companies and the billionaires at the expense of us individual human beings just doing whatever they tell us to do. But they say, and go watch the Great Reset video, they say in 2030, you will own nothing, but you will be happy.
Yeah.
Right? They're trying to put this message across to say, look, you won't own anything. You don't have to make decisions for yourself or your health anymore. We'll do all that for you. You just have an easy, relaxed life. You don't have to worry about any of it. And you'll be happy, by the way. So it's this brainwashing, it's this conditioning that's happening. That's why I say we're at this precipice. We're at this breaking point right now. And in the next few years, where we have to decide what we truly want for ourselves. Do we want sovereignty? Do we want sovereignty in health? Freedom, the freedom to choose what we can and can't, what we decide to put in our bodies, and do we want forced vaccinations? Do we want forced stay-at-home orders? Do we want forced treatments for cancer, like they've been doing? The child, and I believe it was in California a number of years back, they took from the parents and forced that child to get chemotherapy against the parents' wishes. Do we want more of that? Or do we want our freedom, our sovereignty, our ability to think and choose and research for ourselves, our freedom to put the chemicals in our body or not put them in our body, the freedom to put the herbs in our body or not put them in our body? I'll tell you what, I am voting and standing with the people who want the freedom, the sovereignty to choose what is right for us. And each of us have to choose that for ourselves. And to do that, we have to educate ourselves. I think your audience is probably a very educated audience. I know you do these podcasts and you put out a lot of good information through your website. So I think most people tuning in are in alignment with, a more natural, holistic, or integrative approach is probably a better approach for them when deciding, how to take care of their health for the long term. But again, a lot of people don't even have access to that information yet. So I do want to encourage everyone tuning in, not only share this video and share it as far and wide as you possibly can on every social media site and with friends and family and email, but share Dr. Connor's website, his books, his blog, his podcast with as many people as you can every day, because it is so important with the censorship that's happening, as you mentioned, from this ever-growing technocratic censorship of, honestly, let's face it, we're heading towards fascism if we don't do something about it. The information is not reaching the people who need it, who it could save their lives, unless people like you who are tuning in are sharing this with as many people as possible. So, it's up to us. I guess that's my point. Then I'll get off my soapbox here for a second, because I got a little passionate there about what we're going through, because I've spent a lot of time being censored, being the person who's being censored, and watching my colleagues being censored, and watching people's, with millions of followers, their entire social media accounts being deleted right now for sharing evidence-based research coming out of PubMed and our most respected journals, getting censored because it's not going along with the mainstream narrative that's being pumped out by, this ever-growing technocratic, government, fascist government that's happening, unfortunately. So it's up to each one of us. We must learn, educate, continue to educate ourselves, learn as much as we can through resources like this, through connorsclinic.com, through this podcast, through the Health and Healing Club, but then share that with as many people as we possibly can.
Well, Nathan, I cannot agree more. And if you get me on my soapbox, I'm going to scream just as loud. It is so frustrating. I've been doing this 35 years in practice this year. And, remember having small little seminars teaching people about vitamin C, to now we can have these podcasts and go live to millions of people. But still, we've been censored. Our videos have been censored. And we need people to take a stand, whether it's just a simple stand of, I'm not going to wear a mask, or a simple stand of sharing information on why I'm not going to get the vaccine. The point isn't the vaccine or the mask. The point is having the freedom to choose. And we are losing that in this country so rapidly that it's a little scary in a sense. But it takes every single person who believes in health freedom, even if you want to get the vaccine, that you believe that you have a freedom of choice, and that you could use the wisdom that God gave you to make your own decisions. And when you lose the ability to make your own decisions about your health care, you're going to lose very rapidly decisions to make about what you can eat, what you can buy, how you can spend your money. And it's just going to go right down this very slippery slope. So I would agree with you. We need to share this information. I just thanks so much for having, being available. I would love to have you on again, Nathan, if you're willing. I love it when you get on your soapbox, because it's not just me screaming to my patients either. They can see there's other crazy people out there too that believe the same way, and that there's can be comfort in that. So
hey, look, it's the crazy ones that have always helped, move humanity forward, right? And I think everyone tuning in here has a little bit of that craziness, and the good crazy is what we're talking about, right? And that's what we need. We need that conviction, that craziness, that little bit of, confidence and courage. Really, it's courage in a time of silencing and punishment, to stand up against tyranny and say, look, we've got to come together and fight for what's right for ourselves, for our children. I have 2 young children. I'm thinking about what's right for them, and I'm thinking about what's right for their children and their children. And so, if we just sit back and don't do anything, guess what? The people who want to control us and have more power are going to certainly take it, because when has absolute power never absolutely corrupted, right? We know that it always happens unless you and I stand up and do something about it.
Well, Nathan, your website, NathanCrane, CRANE.com. I encourage everybody to go to that. We'll have links on this for everyone, and we'll put links on the blog. Thank you for being a part of our podcast today. And I'm going to be on your cancer, what do you call it again? Sorry, blanked there.
Summit, our upcoming summit. Yep.
Yeah. That's going to be exciting.
Looking forward to that. And I want to give everyone, actually at nathancrane.com, we did put a free ebook there for everybody tuning in here that can go there and download it absolutely free. It's called the 5 Natural Pillars for Helping Prevent and Reverse Cancer. You can download that absolutely free at nathancrane.com. And Dr. Connors, thank you so much. Thank you for doing the great work you do, and for being, really a pioneer in the field. You've been doing this a long time, and I really am honored and humbled to, be able to speak with your community here today. So thank you.
All right. Thank you so much. Bye-bye.